We're just waiting for quorum. We still need one more person.
Okay.
Madam Chair, I have to leave at 1:45, so hopefully there's more than me that
You're
makes
telling us we
quorum.
have to be quick?
Isn't that a standard rule?
Okay, we now have quorum. So I'd like to welcome everyone to the Planning and Economic Development Committee of Wednesday, April 15th. I'd like to call this meeting to order and ask the clerk to conduct a roll call.
Thank you, Chair. Councillor Badaway.
Present.
Councillor Bateman. Councillor Campion. Acting Regional Chair Ganan. Councillor Greenwood. Councillor Jordan. Councillor Junkin.
Here.
Councillor Kaiser. Councillor Morocco.
Present.
Councillor Olson.
Present.
Councillor Redicott.
Here.
Councillor Rigby.
Present.
Councillor Cisco. Councillor Steele.
Here.
Councillor Ugolini.
Present.
Councillor Widdeby.
Present, thank you.
And we have regrets today from Councillor Foster, Chair.
Thank you. Niagara region is situated on treaty land. This land is steeped in the rich history of the First Nations, such as the Adirondack, the Haudenosaunee, and the Anishinaabe, including the Mississaugas of the Credit First Nation. There are many First Nations, Métis, and Inuit from across Turtle Island that live and work in Niagara today. The regional municipality of Niagara stands with all Indigenous people, past and present, in promoting the wise stewardship of the lands in which we live. I'm asking now if there are any disclosures of pecuniary interest. Seeing none, there are no items for consideration today. However, we do have some consent items for information. 5.1 is ED 4-2026, Physician Recruitment Update. I'll call on Jill Croteau, Physician Recruitment's Program Manager, for their presentation respecting Physician Recruitment Update. Welcome, Jill.
Thank you, Chair. So thank you for allowing me to present an update on the physician recruitment program. I will be going over some successes from 2025 and then some direction into 2026. So we can start by just a short overview of the program. So the Niagara Physician Recruitment Program has a number of service pillars, which are designed to attract and retain physicians to the region. So we have a comprehensive recruitment strategy to showcase our municipalities as a destination of choice, and we engage frequently at the regional, provincial, national, and international level. The program supports physicians with identifying the right fit for their families, which include a series of licensing and immigration pathway navigations. We connect physicians to the right clinics and physician leaders to help them start the process to build or take over a practice, and provide onboarding and resource support, which includes advertising for patients and connections, finding accommodations, and recommending schools, sports, and activities for their children. The program's very engaged in the community and works closely with area municipalities, Niagara Ontario Health Team, our Niagara Practitioners Healthcare Alliance, which is our primary care network, and McMaster University to determine future need and plan for the future. And as a new pillar, we also have been working diligently with Niagara Health. We're in the process now of an MOU, and in 2026, we plan a closer relationship for recruitment strategy around priority areas for the hospital, which includes emergency medicine and internal medicine, and anything else that might be deemed a priority at the time. So from our local physician recruitment database, we were able to come up with a bit of a plot map for primary care offices within the region. So this aligns with our local Niagara physician recruitment primary care database, as well as benchmarking that data with the College of Physicians and Surgeons of Ontario, their information that they are able to provide us with as well. So this distribution map is very helpful. The smaller bubbles, obviously, they're the smaller offices, maybe 1 to 2 physicians, and then the larger bubbles are 6 to 10 physicians. So this is very helpful for us when we're planning. It adds a layer to other health services, so we can project growth and aid us in our future planning. So just an overview of the, I guess, a snapshot of primary care in Niagara. According to our 2025 census, we have landed at about 551,000 in terms of our population. With our ministry data that we've received in January, we have noted that Niagara has 262 signatory physicians. So those are physicians that enroll patients into a ministry model. So the alphabet soup of the FOs, FIGs, and CCMs, so family health organizations, family health groups, and comprehensive care models. With those physicians, we also have noted that they have enrolled just over 354,000 patients within their borders. So this actually captures about 62% of the population if you benchmark that to our current census data. In January 2026, from our local physician recruitment database, we do know that there are 292 doctors. So with our population and our recommended average practice size, we can calculate that it is recommended that we have 399 physicians, which is about 107 less than what we have currently. We also know from the ministry data that those physicians over 65, which is about 10% of, is about 14% of the physician population, but about 10% of our regional population, enroll about 53,000 people. So just, highlighting that succession planning is still very important in our strategy. So this is again, a snapshot on the municipalities, a list of all the municipalities, the average practice size of each, average practice size of physicians within those municipalities, the census data, and then the total number of doctors that we have in our database, and then the number of suggested, I guess, how much we can estimate that we need based on our population and the average practice size. And then again, breaking it down by municipality. So as a total, it's 107, but then we can see how it breaks down within each of the municipalities. And then also keeping in mind that 107 is really as the denominator changes. So the average practice size, as the primary care action team, as they add funding for primary care teams, those average practice sizes will go up. There's also been some changes with our family health organization model as of April the 1st. So that's also designed to encourage doctors to enroll more patients. So the average practice size will eventually come up and our shortage will go down over time. So this slide just outlines our recruitment trends in 2025. So just noting that 71% of the doctors that came in last year were recruited from the United Kingdom. There's still a steady stream of interest from doctors coming out of the NHS, not that we're trying to take their doctors, but they're happy to come to Niagara and into Ontario. So just also highlighting that immigration is definitely at the forefront. Understanding the immigration pathways has also become extremely important. So not just a work permit, but obtaining a permanent residency quickly, which allows them to buy houses and integrate into our communities. So 14% of the doctors came from Niagara, so out of the McMaster program, 7% from other areas in Ontario, 4% in other areas in Canada, and then 4% from the United States. So just, again, some highlights from 2025. So again, this was a record year for physician recruitment in Niagara. We had 28 new doctors come to the region. We had 15 that retired or left practice during that time, so we are still at a net. We hosted and attended 8 events regionally, provincially, and internationally. We also have 38 plus doctors on our Find a Doctor page, so just attesting to the success. I think we're at a unprecedented time where we do have, quite a few doctors that are accepting in most municipalities across Niagara. And then again, just to highlight the success of the partnership with some of our community, our Niagara Practitioners Healthcare Alliance, which is our primary care network. So our Connect to Care campaign has been extremely successful during that time, but just outlining the partnerships with our local community organizations. So another, I guess, highlight from 2025, just to highlight, over the last couple of years, there's been a development with physician recruiters across Ontario. So we have formed an organization which collectively we have been able to highlight opportunities in Ontario, outside of Ontario. So within that organization, we have a job board, an applicant tracking system, and we have pretty close to 5,000 candidates who are tracked. So those are all physicians that are looking to come into Ontario. So again, this just highlights the collaboration that we're not just locally, so regionally, provincially, and abroad. So I also wanted to just highlight the return on investment for physician recruitment. So again, I know the financial piece, the budget, it always does come up, but just to note that for every dollar that's invested in physician recruitment, this can generate at minimum $12 to $30 in return. So that comes from a JUPA consultant report. The Conference Board of Canada also found that a 1% improvement in population health also translates to a 1.7 increase in workforce productivity. So just showing the close linkage between economic development and physician recruitment. So again, physician recruitment and retention, it's not just about healthcare coverage, it's about building and maintaining economic infrastructure. So that was it. Thank you very much.
Well, thank you, Jill. Are there any questions for our presenter? I'm seeing Councillor Redicott.
Thank you, Chair, and thank you very much, Jill, for the presentation. And I just want to compliment you on the work that you're doing and how important it is to the people who live in Niagara. But I did have some questions, and you mentioned during the course of your presentation that with some of the provincial policies relative to healthcare and family physicians, et cetera, it's anticipated that the average practice size for family physicians will increase. Did I hear that properly?
So through the chair, I think it's safe to assume that with added resources such as allied health, nurse practitioners, if you're increasing the team that's wrapping around the patient, that there's more capacity for physicians to enroll more patients.
So do you know if the provincial policies are hinging on that, hinging on family physicians taking on more patients in the future?
So with the new FO Plus, as of April the 1st, there is incentive for doctors to enroll new patients, specifically in that FO model. Actually, across the board in all models, there's incentive for them to enroll patients that do not already have a doctor. So we can suspect that practice sizes will go up a bit.
Can we go to slide 5 in the presentation you made, because that's the one that deals with the municipalities, the number of physicians, et cetera. So this is startling to me in the sense that there's a significant variance in the number of, or the average practice size throughout the region. And I'm particularly fascinated by the data relative to Fort Erie, which suggests that these physicians are carrying a patient load of almost 2,000 people, which is 40, 45, 50% more than some of the other municipalities. Is there an explanation for that?
Well, yeah, I can say that Fort Erie does have a higher number of family health group doctors who do have larger practice sizes because they run a family practice and a walk-in clinic. So those practices tend to have larger rosters, whereas the FHO model tend to have smaller rosters. So that would be my guess.
So if I might, Chair, just to go down that road. So are there more physicians in Fort Erie that practice on a fee-for-service basis than in the FO model?
Through the chair, I wouldn't know the exact breakdown, but I think that based on the number of doctors, it's probably about a third would be in a family health group.
And would that account for much of the variation then in the average practice sizes in Niagara?
That would be my guess.
So in the case of Fort Erie, if these doctors are carrying an average practice size of almost 2,000, that means some of them are carrying less and some of them are carrying more. Is it realistic to expect that these physicians are going to expand their patient base?
I don't know if I can comment on that.
Okay.
It's
That's-
very individual up to the practice.
That's fair enough. And if I might, Chair, does your efforts to recruit, do they reflect the numbers on this chart? In other words, with the family physicians in Fort Erie having an average practice of 2,000, you're projecting that there's another 3 physicians needed in Fort Erie. Some of the other municipalities have significantly smaller average practice sizes, and the anticipated additional number of physicians they need accordingly would be higher. Does that have any impact on your efforts to recruit physicians in Niagara? In other words, do you focus on the areas that seem to have a greater need for physicians, regardless of the family practice sizes?
So again, through the chair, I think it's very individual for the physician that's coming into the community if they're wanting to build a small or a large practice. So again, it depends on the model. It depends on space availability. There's a lot of factors that go into it. So I don't know if I can comment 100% on what what people are looking for. It's really up to the individual doctor that's looking at that community.
Thank you. And then finally, Chair, aside from Fort Erie, which has a community health coordinator that assists you with physician recruitment, are there other municipalities in Niagara that do the same?
So Fort Erie specifically has a health services coordinator that we work very closely together. Other municipalities, I work very closely with the economic development officers or directors, but I would say for the most part, there are others that do participate in our regional committee. So they do have a role to play for sure.
Okay, thank you very much. Thank you, Chair.
Thank you, Councillor Whitacroft. Councillor Whitavine.
Well, thank you, Madam Chair, and thank you, Joe, for this, I guess, update. So it's much appreciated. So my question is more geared around the shortage of the 107 physicians. Now, if I recall, I'm thinking it's probably seems like yesterday, but I'll say it's been about a year that we had a group coming forward to this committee or to public health that were, I guess, that had the skills to be physicians, but were kind of challenged with the College of Physicians to get their credentials so that they could practice in our community. And so my thought process this afternoon is where are we with that group of individuals that wanted to have those that are trained in other countries come here and be qualified to practice here, and hopefully filling some of this gap that we have in our community.
I can answer that. So through the chair. So I guess that there's two answers to that. One is we do significant outreach in other countries to work with physicians who are internationally trained to fill those gaps. And secondly, I believe it was Moises Vasquez and his through the Welland Council who did that presentation. And again, I don't think that's something that we have control over. That would be the Medical Council of Canada, the College of Physicians and Surgeons, to really dictate what the criteria might be or where the approved jurisdictions are for licensing. And I think that a big piece from that presentation was that there are quite a few internationally trained medical professionals that are working in our communities that can be of assistance in the clinics. So whether it's maybe it's not necessarily a physician, but maybe it's a medical office assistant or another meaningful position where they can utilize their skills.
Okay, well, thank you for that, and I guess you answered my question that you're not actively working with them to help because that's, I guess, out of your jurisdiction. But anyways, thanks for the update. I was that's much appreciated because we have these individuals here, and it's just a matter of I guess solving where we can place them the best to help in giving our residents a level of health care. So thank you again, Joe.
Thank you, Councillor Woodavine. Councillor Olson, you're next, please.
Yes, thank you, Chair, and thank you for the presentation. I'm looking at your Appendix 1, the event engagement plan, and 70% of our approximately come from the UK or trained in the UK. And I see we have something called the OPRA Birmingham. And what type of event is that? Is that like a trade event supported by the embassy and that type of thing?
Actually, that is put on by Oprah. So I am the founder of Oprah, and I'm on the planning committee for the event. So every year we engage with physicians. We have a database that we are building. We do a lot of outreach to target physicians who are looking to move to Ontario specifically. So this year, June the 6th, we'll have the event in Birmingham, and we expect to have about 100 doctors there.
Okay. Thank you. And Chair, through you, Chair, I didn't want to venture what OPRA meant, but I guess could you tell me what that means now?
Ontario Physician Recruitment Alliance.
Yeah, you probably know better than anybody what that says. So what are the things that you find in those meetings and that's attractive to doctors wishing to move from the UK? Because I assume they have a choice.
Absolutely, through the chair. I think that lifestyle is extremely important. There's a lot of risk when they're moving from another country to Ontario. So they want assurance that there's going to be enough patients. They want assurance that there's the right model of care, that there's the right clinic space. Often, they're coming from middle stages of their career, so coming into a supportive environment where maybe overhead is a little bit less, and maybe there is funding for them to get started, is also very helpful.
Thank you, Chair. Through you, Chair. I guess I was thinking that we would have something like political stability, predictability, schools, education, because they bring their families with them and they want to make sure they have opportunities for advanced education and that type of thing. I'm imagining. So, is that correct?
Through the chair, yes, they're looking for all of those types of things. And again, it really depends on their lifestyle. So some physicians are very interested in rural and remote. Some physicians are interested in kind of a suburban mid populations, and some are looking for larger urban centers. So it's really just talking to them to get to know them and find out what their preferences are.
Thank you. Through you, Chair, do you have the support of the embassy in the UK for these meetings, or are they supportive? Or because I'm thinking of in terms of immigration and that type of thing, support right on site.
So this year, we have invited the OINP, so the Ontario Provincial Nominee Program. So our ministry will be attending that event, hopefully. Cross fingers, I shouldn't. But hopefully they've been doing a lot of presentations with us in partnership. So there is some support in terms of the immigration on site.
Thank you, Chair.
Thank you, Councillor Olson. I'm not seeing any other speakers, so thank you, Jill, for the presentation, and keep up the good work.
Thank you.
Thank you. Can I get a mover and seconder then for the presentation on physician recruitment update? Okay, can we, thank you, Councillor Ugolini and Councillor Rigby. Okay, I'll next call on, do we have any speakers who wish to speak any further to this presentation? Seeing none, then I'll call the question. Could you please vote electronically? Almost missed it. All right, that was approved and accepted. Next, I'm going to call on Brian Cohn, Indigenous Relationship Specialist, for the presentation respecting Niagara Region Indigenous Truth and Reconciliation Plan. Welcome.
Thank you. Tansi, good afternoon. My name is Brian Kahn. I am the Indigenous Relations Specialist here at Niagara Region. Today, I will be providing highlights of the Niagara Region's Indigenous Truth and Reconciliation Plan. Materials supporting my presentation were included in Appendix 1 of your committee package for the meeting today. How do I advance the slides? Did I cover it? Oh, I'm sorry, I covered it. Okay, so the Indigenous Truth and Reconciliation Plan is a 5-year plan intended to assist Niagara Region along its path of reconciliation with the Indigenous people here on Turtle Island. Oops. We'll get there. All right, so the process in developing the plan included reviewing local, national, and international reports that offered recommendations on how to repair the impact of colonization on Indigenous people here of Turtle Island. As well, we reviewed action plans developed by other municipalities and organizations from across the country. We worked directly with the local Indigenous community, seeking their guidance as the action plan was being developed. Their feedback helped shape and reshape the plan. With every iteration, we went back to community for their response to our interpretation of what was being developed. And before the plan was finalized, we met with the various departments and programs within Niagara Region to ensure we had their support. In asking for their support, we also sought their commitment to actively participating in areas of the action plan that connected specifically with their work here at Niagara Region. Much of the work we have developed as part of the action plan connects with a statement made by Regional Council in June of 2022, where Council committed to creating a plan that would work towards reconciliation between Niagara Region and the Indigenous community. At the time, it was said the plan would guide the region in creating inclusive policies, programs, and services that impact the residents of Niagara. It would also create an environment that is welcoming and culturally aware of the diverse population of staff working here at the region. Members of the Indigenous community have helped throughout the process of developing the plan. In fact, they helped lay the foundation that gave us our initial direction. In 2019 and 2021, 2 separate reports commissioned by Niagara Region were written by local Indigenous leaders who involved Indigenous community in providing feedback on the local public health and emergency services, as well as identifying issues relating to the sense of safety and belonging for Indigenous people here in Niagara. The two reports identified gaps in service delivery and provided recommendations for Niagara Region to follow. Among the region's response to the recommendations, Council prepared its statement against systemic racism towards Indigenous people. In doing so, Council also committed to creating an action plan that would help address the issue. It was a recommendation from the reports that the action plan be developed by an Indigenous person who would act as a liaison between Council, region staff, and the Indigenous community. Together with my colleague Chantal Berry, who works as the Indigenous Health Specialist in Public Health, Chantal and I worked together in developing the plan as a way of ensuring it represents the needs and expectations of community, and that it was written in a way that spoke to the Indigenous community as proof that they had been heard. Another recommendation from the community reports was to create regular and ongoing meetings between senior leadership from Niagara Region with the leadership from local Indigenous community agencies. These meetings are referred to as the Joint Roundtable. The buy-in from the local community agency leadership who are part of the Joint Roundtable have been invaluable in helping us connect with their staff and the people they serve throughout the region. And it's opened the door for other departments here at the region to also access the same community connections. Another benefit of the Joint Roundtable was that the corporate leadership team from the region was given firsthand insight into the perspective and worldviews of First Nations, Inuit, and Métis during these meetings. In addition to approximately 200 people we engaged with directly in developing the Indigenous Truth and Reconciliation Plan, we need also to include the many dozens of community members who participated with the two Indigenous consultants performing their research in 2019 and 2021. That was the base for much of the work that has happened in the region since then. One of the recommendations from the Joint Roundtable review of the action plan was to share the plan with non-Indigenous community agencies as a way of increasing the likelihood there would be support for the plan across Niagara beyond just that of the Indigenous community. Throughout the process of developing the Indigenous Truth and Reconciliation Plan, we had a great deal of advice and guidance, some of which actually caused us to stop, rethink our strategy, and realign our approach in how we developed the plan. Community told us to simplify the document. They wanted us to focus on actions that were attainable by Niagara Region staff, rather than trying to solve the many recommendations listed in the national reports. Once the two Indigenous positions were filled here at the region, Chantal and I were able to bring a more intimate understanding of what Indigenous community was expecting from the region in developing the plan. And community didn't want the action plan to be a standalone document that was only the responsibility of Chantal and myself. They wanted this action plan to be part of a holistic commitment to reconciliation by the region. And this means bringing Indigenous voices into the plans of other programs for all departments. By the time we were done preparing the document, we had limited our priorities to three key areas listed here. If we focus on the image at the right of the slide, we see that First Nations, Métis, and Inuit are at the center of the plan. The circle is a cultural reference for Indigenous people. It also represents that the three priorities are interconnected equally with one another, and how each priority supports the success of the other two. Your committee package included the full action plan, so I'll just be highlighting a few of the key points on the next couple of slides. We all know that relationships are strengthened through enhanced communication. The Indigenous Truth and Reconciliation Plan is our commitment to ensuring regular and meaningful communication will take place between the region and the Indigenous community. The ongoing meetings of the Joint Roundtable are one example of how information will continue to be exchanged between community and the region. Your package for today's meeting also included a document called Niagara Region's Indigenous Update 2025. That highlights some of the Indigenous-focused accomplishments of the region throughout the past year. Future updates will highlight annual accomplishments of the Indigenous Truth and Reconciliation Plan. And this is another way that we can demonstrate that the role of Indigenous people was not only to help write the plan, but that we would keep them informed and continue to listen to their voices throughout its implementation. The plan encourages all departments to include Indigenous voices when developing, delivering, or reviewing programs and services offered by Niagara Region. This includes listening to and supporting staff who are Métis, Inuit, or First Nations in celebrating their cultural identity at work. The plan is also looking to Council to review its statement from 2022 about addressing systemic discrimination and anti-Indigenous racism by continuing to develop its relationship with the Indigenous community. And that relationship will be enhanced through an active education plan. It's too easy to think that we're all the same, but the cultural divide is more significant than most people realize. Generations of colonial control and a push to eradicate the traditional ways of First Nations, Métis, and Inuit has had a significant impact on the Indigenous community even today. Ignoring these differences, or not being aware that these differences even exist, will determine whether or not reconciliation is even achievable. As a service provider, we know that some of our programs that we offer here at the region, in particular those that serve at-risk communities, have a large number of clients who are Indigenous. Therefore, the success of delivering those programs will be determined by our ability to understand the unique lived experiences of the Indigenous community, as well as our ability to respond to their specific needs. So I'll take just a moment and give an example of how the three priorities come together. If we look specifically to the upcoming National Day of Awareness for Missing and Murdered Indigenous Women, Girls, and Two-Spirit People, also known as Red Dress Day, we are building relationships with the Indigenous community by showing support and acknowledging the devastating impact and the loss of women, girls, and Two-Spirit people who are 12 times more likely to be murdered or go missing than non-Indigenous women, girls, and Two-Spirit here in this country. We educate staff about the significance of the day and its impact on the Indigenous community. We invite guest speakers who have lived experiences to share their journey of trauma, resilience, and healing. And if we look to how this might affect service delivery at the region, we recognize that emergency services, public health, and housing each have a direct connection with the women, girls, and Two-Spirit people who are impacted by this phenomenon. As part of your journey, I invite each of you to attend the upcoming Red Dress Day event here at Niagara Region on May 4th at 11 a.m. As mentioned earlier, the feedback received from the Indigenous community was that the Indigenous Truth and Reconciliation Plan should not be a standalone document. This slide highlights that because of the two community-based reports, 4 Niagara Region strategies specifically address the issues that relate to the Indigenous community. These action plans have already been presented to Council and demonstrate the positive step Niagara Region has taken by including solutions that respond to Indigenous voices. And while this is a 5-year plan starting in 2026, I want to emphasize that some of the work mentioned here today and had already begun while the plan was being developed. It was influenced by community feedback and that we received while writing the plan, but there are still portions that have yet to be implemented, and I look forward to working with the many staff and service providers that are part of the action plan that's presented today. And so as I finish in closing, I'd like to emphasize that this plan responds to the local, national, and international documents that call for reconciliation with Indigenous people of Turtle Island. It aligns with the work being done by other municipalities throughout Ontario and across the country. It's been reviewed by Niagara Region staff who've made a commitment to help achieve the actions highlighted in the plan. And most importantly, it's a positive step towards addressing the needs and expectations of the local Indigenous community. And with that, I say thank you and miigwech. I'm open to any questions that you may have.
Thank you for your presentation, Brian. Do we have any questions to our speaker? Not seeing any. Thank you so
Wonderful.
much for joining us
Thank you.
today. Can I get a mover and seconder then to accept the presentation? Councillor Olson and Acting Chair Gannon. I'll get that together soon. Thank you. So, any discussion on the item before us? Okay. Then seeing none, can I ask you to vote on the presentation electronically, please? Okay, that was approved. Thank you. Our next item is shared services update. There's no presentation on this. Can I get a mover and seconder for item 5.3 PDS C2-226? Councillor Ugalini, and can I get Councillor Witteveen to second it, please? Thank you. Is there any discussion on this item? Councillor Olson.
Yes, thank you, Chair, and I'd like to know, there's a number of opportunities here that have been put in place for shared services. Is there an accompanying chart that shows what the savings would be, the annual savings would be from each one of the steps that's been taken?
I think Shannon's going to answer this for us. Thank you.
Thank you. Through the chair, we have been tracking the savings when we have information available from what was previously done. A benefit to the shared services work that we're doing specifically with procurement is we're tracking moving forward, but historically we haven't been able to gather the costing information. So in the coming reports, we'll be able to provide information on the cost savings, but at this time we don't have information from what was previously done.
Okay, thank you, Chair. So, and will that information include KPIs and things like that?
Through the chair, yes, we're going to continue building on the existing KPIs stated in this memo, as well as building more as we continue to gather more information.
Okay, thank you. Thank you, Chair.
Thank you. Is there any other questions or discussion at this point? Thank you, Shannon. Okay, seeing, oh, sorry. Councillor Campion.
Yeah, sorry. Thank you for that. I snuck in. I had a question with regards to when we're talking about joint services and efficiencies and cost savings. We see what I'm seeing here is that we have the region heading this up, and then we've got the LAMs participating as working together. But I'm a little bit concerned with how that's actually set up, because I think we've been doing this for probably, well, almost as long as I can remember. Certainly goes back into the, 2019 and even prior to that. And we don't seem to be getting a lot of traction. But my concern is that the lower area municipalities have services that they provide amongst themselves. And then we have regional services that are provided over here. So I don't think we're at a point now, except for contracts and things like that, where we're actually matching the right people up. We need to have the local area municipalities working together, sharing the services they have. And one example that I could think of is on the planning side. We essentially, as a region, are not in the planning business, but we're still in the planning business by providing services to municipalities that can't or don't have the people or the finances, et cetera, to have their own planning departments. I think that's a correct statement because we've been talking about that. Where we should be looking at is if the region is not in planning, it should be the lower area municipalities who are partnering to provide services to each other, as opposed to buying services from the regions, from something that we're not supposed to be doing. So with the region heading this up, is that a conversation that's being had? So it's through the chair to whoever could answer that question. Are they talking about those types of things as well? Things that the region shouldn't be doing, that the LAMs are doing. They should be partnering on the LAM side as opposed to trying to sell services from the regional side for things that we're not supposed to be doing. Makes sense to me, but I don't know if anybody else can understand the question. So through the chair.
Thank you. Through you, Chair. There's a few things to that question. One, Council will recall where it was just resourcing or supporting the work strictly between municipalities. There was a resource that was shared with the local municipalities, half and half, with the region and proportionally shared with the local municipalities. there wasn't unanimity among the local municipalities to continue with that cost-sharing arrangement, so that role and responsibility ceased to exist. What the work we continue to do has implications with regional jurisdiction or responsibility. The specific example with planning, there is nothing that we are doing or other work that precludes locals from working together to share those resources. Where we are now with a fee-for-service arrangement was actually the outcome of an exercise with all of the locals. Back when the legislation was first introduced, this was a model that was desirable to many of the locals and now exists. There's nothing to preclude that from now reverting to some shared mechanism between locals. They're welcome to do that work.
So, thanks for that. My concern is we should be encouraging that as opposed to saying nobody's complained about it, or nobody's brought anything else forward. If we're truly trying to talk about shared services, we should be looking at that across the board. So my question again through you is, so is this something I should be talking to my CAO about?
Yes.
And having her bring that forward?
Through your chair, that's correct.
Okay, thank you.
Thank you, Councillor Campion. Councillor Redicott, you're next, please.
Thank you, Chair. Just to follow that a little bit, I know that the CAOs meet regularly, and I know a little bit about some of the discussion that's taken place. So I'm presuming that if we want the region to get out of planning altogether, that's something that the regional council would have to direct. Is that correct?
Through you, Chair, this was in fact a matter of discussion at budget time. We're in the business because local municipalities requested that we be in the business.
So that could very well be. So there may be some customers there. But if the customers don't have the product available, which is the region providing some planning services in an area that they no longer are authorized legislatively to occupy, we could, as a council, I presume, simply direct staff to no longer be in that particular space. And that would compel municipalities to work among themselves, would it not?
Through you, Chair, that is the will of council. That's the nature of the discussion that happened at budget time, and it wasn't directed.
Yeah. Okay. Thanks very much, Chair.
Thank you, Councillor Redicott. Any more questions? Okay. Seeing none, then I'll call the question. Please vote electronically. Okay, that's been approved then. Are there any items of new business to discuss at this time? The next section, which is the closed session. Do any committee members wish to discuss 7.1 confidential report PDS 8-2026 in closed session? Okay, not seeing anyone. Then we'll skip right down to item 8, business arising from the closed session items. Can I have a mover and seconder for item 7.1, confidential PDS 8-2026? How about Councillor Steele and Councillor Cisco? Okay. So we have the motion on the screen then. So if there's no discussion, then I'll call the question and please vote electronically. And that is approved. So our next meeting then will be held on Wednesday, May 13th, 2026 at 1 o'clock at the Council Chamber Regional Headquarters. We are now adjourned. Have a lovely afternoon.
Good job, Madam Chair.